the number? I'm sure many of you are asking about the numbers. What's the optimum number? If you look at the literatures, this is one of the radiology literatures. It states that if you obtain 5 cores, you will be able to identify the diagnosis in 99% of cases presented with mass. So presented with mass, you can obtain the diagnosis in 99% with 5 cores. What about microcalcifications? So the literature says 6 cores is really helpful to obtain the diagnosis in 92% of cases. So the recommendation is not to make it less than 5 cores for lesions that are presented as mass, and 6 cores for lesions that are identifiable as microcalcification. And definitely for us in pathology, we don't mind having more. If you give us more, we will be more than happy. Another thing also we really need from the radiologist, you now in today's practice are the ones submitting the sample to us. You are also the one writing the request form and sending it to the pathology department. We would like to have a good, essential, and important clinical information to be provided to us in the pathology report. Definitely, we need to know the age. There are many breast lesions are specific for certain age groups, so the age is essential as well as also the gender. I know you are dealing a lot with female breasts, but I assume all the breast lesions are coming from the female. We see breast core biopsy coming from male, so please mention this and indicate it. Luckily, many hospitals, they have a system, and also we do have, we don't need to do this because it's really printed in most of the requests, in all the request forms. So that's, if you don't have the facility to have it printed already in the request form, make sure that this information is also there. We also would like to have, if the patients have any treatment history information. That's really important for us because with today's practice, with a lot of new adjuvant chemotherapy is not given to the patient, these will make changes that for us it's important to know if there's a treatment there, otherwise we will overcall things. It's also important for us in the request form to have physical and radiological findings. That will make our diagnosis and interpretations really quick and concordant with your radiological and physical finding. Location is really essential. We want to know if it's right or left, and we really frustrated when we receive a request form without saying if it's right breast or left breast, because you know the pathology report is a document, and and it will go to the treating physicians, and if they don't know the sites, we will just finish the report and say unidentified sites, and that doesn't really look good for the pathology report as also for the radiology departments. If it's the lesion is lateral, bilateral, or unilateral, this information is also very important for us. If you have a specimen radiograph, we would like to know if there is a radiographic findings also obtained from the specimen. If we don't have a facility to provide it to us in the system, tell us about the radiological findings in the specimen itself.